It's always the same story. The patient was in the ER. They come back to me. They told me to come back and see my primary doctor. Okay. And I'm like, well, what happened? And again, patient, I don't know. They said to come back and see you. Okay. So now I have to backtrack. Okay. And because I've been doing this a while, I know kind of the questions to ask. What'd you go for? Oh, my stomach hurt. Oh, okay. Did they do any blood tests? Yes. Okay. Call the lab, get the lab set. Did they do a CAT scan or ultrasound? Yeah, they did. They put me on a table and I had to go in the machine. Oh, okay.
To be taken to the clinic and in the basement and talking with the CEO and talking with a doctor and talking to a mental health expert there, but also then to get a journalist who wrote an 8-story series about this particular place. It was very inspiring in a way that I think everybody walked away from that panel discussion with a visceral sense of why these subject matters are important.
This fellowship, I think, is really beneficial for me. After listening to all those speakers or my fellows, I have like this long list of stories I want to cover in the future.
It was like boot camp, where it's very comprehensive. You can tell a lot of thought went into having sources that we'll be able to use for months and years going forward, working on your skills.
Getting exposed to all of it in a short period of time and also discussing with other writers about what they're doing helps fit the pieces in the, together.
The exciting part of that about, like for me, not like all these things I don't know, is that I have all these story ideas now. So I have this list that I'm going home with of, oh, look into this and look into that. And
I really feel, that the information I know about health is just really a small piece of health, It's kind of giving me this motivation to learn more. I feel learning never should stop.
It gave me access to people that I never would have normally. I feel it would have been a lot harder for me to get access to just because of the nature of where I live. And it's made me feel less intimidated about approaching maybe the CEO of a really big nonprofit up there and to say like, well, I've sat in a room with like this person and that person now, and I feel there's like my confidence has been elevated, and I really appreciate that.
How superficial my story used to be. Like I really need to spend time to actually know more and actually go deeper about the health around us.
I think also you do a great job with those resources. I mean, that binder is awesome, and will really be useful.
And I think one of the most important elements that we overlook a lot is just that it gives you a chance to take a step back and think about your work, why it's important, and what you hope to do next with a particular story or project.